Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Hello and welcome to the Health Advocates. I'm Stephen Newmark, Chief Policy Officer at the Global Healthy Living Foundation. Each week we break down the news and tell you what's important in the world of health policy. Today we're talking about a federal announcement that hasn't received much attention in the news, but could have important implications for millions of Americans who are immunocompromised. Recently, the Department of Health and Human Services, HHS, announced its intention to phase out COVID-19 Emergency Use Authorizations, known as EUAs. On its face, that may sound like a routine regulatory change. After all, we're no longer living in the early days of the pandemic. But for many people living with chronic illnesses and weakened immune systems, the questions that follow are incredibly important. Will they continue to have access to the tools they rely on to protect themselves from COVID-19? Let's talk about what this announcement means and why patient voices matter right now. What is an emergency use authorization? An EUA is a mechanism that allows the Food and Drug Administration, the FDA, to make certain medical products available more quickly during a public health emergency. During the COVID-19 pandemic, EUAs help bring vaccines, treatments, diagnostic tests, and preventive therapies to patients much faster than traditional approval processes would have allowed. Now that the public health emergency has ended, HHS has announced that COVID-related EUAs will eventually come to an end as well. That doesn't mean these products will disappear overnight. Instead, it means the FDA must determine the appropriate regulatory pathway moving forward. Why does this matter? For many Americans, COVID-19 has become a manageable illness. But that isn't true for everyone. Millions of us are immunocompromised because of an autoimmune disease, an organ transplant, cancer treatment, a primary immunodeficiency, or medications that we take that intentionally suppress our immune systems. These individuals often remain at much higher risk for severe illness as a result of COVID-19. Vaccination continues to be one of the most important tools we have, and we strongly encourage everyone to discuss vaccination with your healthcare provider. But vaccines do not work equally well for every patient. Some people simply cannot mount a strong immune response, even after receiving recommended vaccine doses. That's why additional preventive options have been so important for many immunocompromised patients. If any part of this is hitting close to home, raise your hand. Go to ghlf.org and sign up for our free newsletter. We break this down in plain language and tell you exactly what's changing and what to watch for. You don't need to follow a policy every day. That's our job, but you should know when it affects you. Back to the show. The issue today isn't whether the EUAs should last forever. They should not. The real question is whether the FDA can establish a clear regulatory pathway before existing authorizations expire. If that pathway isn't communicated in time, patients worry there could be an unnecessary gap in access to preventive therapies while manufacturers work through the traditional approval process. No patient wants to lose access because of regulatory timing rather than because of scientific evidence. One thing we've learned over the years is that policymakers make better decisions when they hear directly from the people affected. Statistics are important, clinical trial data is important, but lived experience matters too. Patients understand what it's like to carefully plan every trip outside of our homes, to wonder whether our medications make us more vulnerable, to worry whether the next COVID variant might affect us differently than it affects others. These perspectives deserve to be part of the conversation. At GHLF, our position is straightforward. We support science-based decision-making. We support rigorous FDA review. We support moving from emergency authorities to traditional regulatory pathways when appropriate. At the same time, we believe immunocompromised patients should not experience unnecessary interruptions in access to evidence-based preventive options simply because regulatory processes are changing. Patients deserve clarity. Healthcare providers deserve clarity, and manufacturers deserve a predictable pathway that allows innovation while maintaining the FDA's high standards for safety and effectiveness. Most importantly, patients deserve to know that their unique needs are being considered. So, what can you do? If you or a loved one is immunocompromised, now is an appropriate time to make your voice heard. Follow developments from the FDA. Stay informed through trusted patient organizations like GHLF. Talk with your healthcare provider about your individual level of risk and the preventive options that may be appropriate for you. And if the FDA provides opportunities for public input, consider sharing your experience. Patient stories help policymakers understand the real-world impact of regulatory decisions. COVID-19 may no longer dominate the headlines, but for many people living with chronic diseases, it remains a daily consideration. As the FDA develops the next chapter of COVID regulation, we hope patient voices remain at the center of that conversation. We'll continue following this issue closely and will keep you informed as new developments emerge. Thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you found this episode helpful, please leave us a rating or review and share it with someone who cares about healthcare policy. And be sure to follow us wherever you get your podcasts. You can find all of GHLF's podcasts at ghlf.org/listen. I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.